The fact that a human being comes to you means maybe he's looking for rescue, help. Yeah? The pioneers started really from the scratch. They started almost from where there was nothing. Operating in very difficult conditions. That slightly eventually improved to operating under tents and working under tents. The welfare was not easy. So it was really a challenging situation according to the pioneers, the facts we get from the colleagues. But still, under those circumstances, really many lives were saved. Despite that severely challenging situation, the comrades, the medics, did to the best of their ability. By the time we came, it was really a crisis. Total lack of health care services. And when you find people in such a situation, you really have to get overwhelmed. Yeah? And the fact that also our medical personnel did good work. My predecessors did good work. And I must really give credit to them. We are really building on what they did. In so doing, they also attracted even more people. That was also part of causing the crisis. Someone, like many people have a belief that if someone gets cholera here, he has to die. So someone comes with cholera or meningitis and goes back alive, or it becomes like now a messenger all over the rest of the population.
How can we prevent HIV?
So this is part of our program. We have public health section. So we do really emphasize on it, not just on the curative. We do both curative and preventive measures. And prevention is better than cure. We do operate that civilian hospital 3 times a week. Monday, Wednesday, and Saturday. And we do see about 150 patients to 200 per visit, per day. That's the day we operate. Talking over 200,000 AMISOM and civilian. And since inception of the mission in 2007. This is field treatment, and this has actually been done all along. It more or less happens to be our doctrine. Yeah? We are not just doing it to these brothers and sisters in Somalia here. This is something we've been doing, and we are just translating it here. And it really adds up, and especially in such a situation where there are no healthcare services, where there has been prolonged conflict, there is no basic healthcare facility. So it's been really an important component in these operations, in the mission. This mission has evolved, and it has indeed evolved. As I said, we started operating and working under tents, and now we are working under United Nations standard prefabs. This level 2 is a mission asset. It's basically the final medical facility in the mission for treatment of AMISOM personnel, TFG, civilians, just as they come as required. We don't discriminate. We treat all. You even treat your enemies. But it's really it's not a conflict in our, you do something wholeheartedly.